In today's video, I'm going to discuss whether or not your doctor is getting IBS right, so stay tuned. If you're a returning viewer, welcome back. And if you're new here, welcome. My name's Amanda Malachewski. I'm a certified functional nutrition health coach and a digestive and allergy detective. For weekly videos on how to find your personal diet and supplement plan for IBS and SIBO, please consider subscribing and be sure to hit that bell to be notified when I post a new video. Today, I want to talk about whether your doctor is getting IBS right. As an IBS and SIBO gut health coach, I meet a lot of people who are struggling with IBS symptoms like bloating, constipation, and diarrhea. Something I hear a lot is that they feel like their doctors haven't really helped them very much, or that they don't really have much of an idea about how to help them. So for today's video, I want to discuss the standard IBS recommendations that doctors often give out and offer a little bit of critique about some of those things, and also discuss which things I feel are useful and helpful. And this is a quick reminder that if you have severe digestive problems, this video is not a substitute for medical advice from your doctor. So if you're having a significant problem, please do go speak with your doctor. All right, let's get started. All right, number one, let's talk about diagnosis first. So typically IBS is a diagnosis of exclusion, meaning that if your doctor has ruled out all of the kind of scary things that might be going on in your gut and they don't know what's causing it, they're going to diagnose you with irritable bowel syndrome or IBS. And because IBS is a syndrome, this means that there's no clear underlying pathology or underlying cause, but more on that in a minute. The standard medical model is to run a bunch of tests to evaluate this. So this might include things like blood tests, stool tests, imaging tests like CT scans. And surprisingly to me, a lot of people report being given endoscopies and colonoscopies even when they're presenting with kind of basic digestive symptoms. The benefit of this approach is that you can be relieved that you don't have anything really significant or severe going on. But the downside is that it doesn't necessarily give you a whole lot of information if you did all that testing and you kind of come up empty-handed. And it can also feel a little discouraging to do all of that expensive and sometimes invasive testing and not have any answers. So from my perspective, for those of you who are having IBS symptoms, and this typically includes bloating, constipation, and diarrhea, and who aren't suffering from an inability to eat, severe weight loss, or bloody or mucousy stool. So if you don't have any of those things, most of this is probably somewhat overkill, and it's probably safe for you to be working on lower hanging fruit first to see if you can get some traction with your symptoms before moving into the more Cadillac zone of medical evaluation and testing. So here I'm thinking about things like simple diet changes, well-recognized gut support supplements, things like probiotics or digestive enzymes, and sometimes SIBO or stool testing. You can always go deeper and look deeper with other diagnostic testing if you don't get the results that you're hoping for. But in the beginning, I feel like these are reasonable approaches before moving on to more complex options. Second thing that I want to focus on is the fact that most conventional doctors will tell you that there is no clear underlying cause for IBS. Remember I said I was going to talk about this in a second? Well, from my perspective, this is categorically wrong, and here's why. Recent research by Dr. Mark Pimentel, who's the recent SIBO research star, indicates that approximately 60% of IBS cases may actually be caused by an underlying SIBO infection. There's a very close correlation between these two groups of people. And if you don't know what SIBO is, it stands for small intestinal bacterial overgrowth. This includes all three types of SIBO, including methane SIBO, hydrogen SIBO, and hydrogen sulfide SIBO, which can correlate alternatively with IBS-D, IBS-C, and mixed IBS. I recently made a video about Dr. Pimentel's recent research discoveries, so I will leave a link for that up here. You can check that out later. The good news about SIBO is that not only can you test for it, but there's also treatment for it. So in a lot of these cases, you may actually have an infection that's directly testable and treatable. So that's amazing. Now, for the remaining 40% of cases that are not directly caused by SIBO, food intolerances are a major underlying potential cause, as are other types of GI infections, which might be visible on something like a GI map stool test or other kind of stool test. IBS-D can also be caused by excess bile acids or by low pancreatic function. And I would hope that if you had IBS-D that your doctor would have screened you for these things in his office when you were doing some kind of workup. Or you can also request testing for these things from your normal doctor or your GI doctor. Now, in some IBS cases, it may not be possible to get clear on what those underlying causes are. And this is certainly frustrating, but this doesn't mean that you're alone with no options. There are definitely ways to move through that soup of unknowing and arrive at answers. And this is the kind of stuff that I teach my clients inside my Calm Digestion Method program. So I'm curious to hear from you if you have a sense or an idea about what might be causing your IBS. So go ahead and leave me a comment down below this video about what you think is your underlying cause. So the third thing I want to talk about that doctors may be recommending is, once you've been conventionally diagnosed with IBS, they may then recommend medications to help manage your symptoms. These can include medications to help with gut motility if you're constipated, or anti-diarrheal things if you have diarrhea, or anti-pain or nausea medications to help with those symptoms, as well as gas reducers if you're suffering from bloating or extensive gas pressure in your digestive system. Now, I know that a lot of you would rather not use medications, and I certainly am in the boat that if I can at all avoid medication, I absolutely want to. I don't really believe in general in using them. At the same time, sometimes these medications can really give people a quality of life back, and there's not really any shame in taking advantage of that to help you get yourself back on track while you are digging deeper for bigger answers. But what most of these medications don't do, of course, is deal with the underlying causes of your IBS. And as long as you're clear on this and you feel okay about that, there's no reason not to use these medications. But what I find challenging here with doctors is that they often seem to come at the situation from a perspective of, well, this is enough. This is all we have for you. And I really don't believe that. I really believe that there is a lot more that's possible for you as an IBS patient to get relief. All right, the fourth thing I want to talk about that doctors might recommend but might kind of miss the mark a little bit with is the diet conversation. Being a nutrition professional, of course, I know a lot about using the diet to manage digestive conditions, and certainly a lot of doctors will self-admit that they don't really know a whole lot about this topic. So fortunately these days, many doctors who are treating IBS patients do actually recommend things like the low FODMAP diet, which has a lot of great data to back it up as a strategy for reducing your IBS symptoms. And I'm always really grateful when my clients tell me, oh, my doctor recommended that I try the low FODMAP diet. But what's not entirely helpful is what happens to a lot of people is they will be given a sheet of paper that just gives them a list of foods to eat and not to eat. And that's all the instruction they get for how to manage their IBS diet, like the low FODMAP diet. To get the most out of any therapeutic diet, including the low FODMAP diet, there's a lot more to it than just working with a list. And most people using these diets need a little bit more support to get the results that they're looking for. So here's a short list of why you need a little bit more support than just the simple piece of paper. Number one, the diet is not meant to be followed long term. And what this means is that you need some kind of exit strategy. You need to go in, get the information you're looking for, and then have a way to get off of that diet or to re-expand your diet beyond that limited elimination phase. Secondly, you're not likely sensitive to every single food on that list, only some of them. And so you need a strategy to figure out which specific ones are bothering you and which ones you can safely add back in. Ultimately, this maximizes your food freedom and your flexibility to live your life while you're dealing with your digestive challenges. Number three is that the food intolerances that are triggering your IBS symptoms may or may not be caused by FODMAPs. And so you need a strategy to evaluate, well, is this the problem or should I be paying attention to something else? And number four, people often need a good bit of support working this new routine into their family life, into their kitchen, into their daily habits. And so this is a place where a coach or professional of some kind can be really helpful to give you ideas about how to work this into your day-to-day reality, because it's not easy making diet changes. So again, I think, it's great that doctors are recommending the low FODMAP diet, but I think that there needs to be a lot more support and effort put into helping people with that process. So if you're someone who really wants to resolve your IBS symptoms from the ground up, I really want to encourage you to download my Roadmap to Gut Recovery, which shares the strategies and tools I use to help my clients find their personalized plan for calm digestion. You can grab your free copy by going to confluencenutrition.com/, roadmap, and I will be sure and leave a link for that below this video as well, so you can head down there and click on it to get there easily. All right, I really want you to get out there and get strategic with your IBS symptoms to really try and dig in and get to the root causes. If you liked this video, please consider clicking like down below this video, leaving a comment, it really helps me out, and consider subscribing if you haven't already. And also consider forwarding it to someone you know that might need this message or this help. I'm here for you to help you improve your digestion. So till next time, see you.